Hey everyone, Ryan here. Welcome back to our patient management series. In this video, we're going to talk about infection control, which is a relatively straightforward topic, but it has some really good high-yield information that can net you at least a few questions on the board exam. So we're going to start with a couple of important times to know. So these are some nice numbers to commit to memory if you have any room for it. So washing your hands should apparently take at least 15 seconds minimum. And flushing ultrasonic scalars, so flushing out the water lines after each patient to ensure a clean water supply for the next patient, should take at least 20 to 30 seconds. So for what they're worth, these are numbers that board examiners have historically stuck to. Next, some routes of transmission. This is some microbiology territory, and these are 4 classic routes of transmission to have a relative familiarity with, because we'll be talking about specific diseases that are important to know in the dental clinic setting, and so routes of transmission will come up there. So our first one is direct contact. So this is direct contact with infected body fluids of another person. Indirect contact is via a fomite. This is some inanimate object like an instrument, clothing, furniture, you name it, it can be a fomite. So something that someone else has touched with some infectious body fluids and then it's transmitted to you via that inanimate object. The next one is droplets or aerosols. So these diseases are spread via infected air. And specifically, you might hear the term droplet nuclei. That's referring to these droplets that are carrying some sort of disease. And lastly, we have parenteral contact. This is via a needle stick injury. So this could be if the needle pokes you in the blood vessel, it could be intravascular, it could be just intramuscular, or it could just be under the skin, subcutaneous, perforated through the skin layer. So these are 4 classic routes of transmission to have, again, a good familiarity with. So now let's talk about a specific group of diseases, and these are hepatitis. It's a group of diseases that cause inflammation of the liver. So Hep A and Hep E are both transmitted fecal-orally. So this is kind of gross, but that means they're transmitted primarily through oral contact with feces. So this typically involves like contaminated food or water, or you could think of kids running around in their diapers at daycare. They can easily be spreading stuff like this, hepatitis A and E, if they're infected and practicing poor hygiene. Now, Hep B and C are transmitted via contaminated blood. So this is percutaneous contact with contaminated blood. It can also be other body fluids like semen. And Hep D is the one on its own. This one's caused by direct contact, also caught with percutaneous or mucosal contact with some infectious blood or other body fluids. But it's usually acquired either as a co-infection or superinfection in people already infected with Hep B. So there are 3 memory tricks I have to help you remember these 5 routes of transmission. So the first one is pretty easy. Hep D is transmitted via direct contact. So just remember D and D. A and E are both fecal-oral. And lo and behold, the 2 vowels in the word fecal are E and A. So that helps you remember that. And lastly, contaminated blood. This phrase begins with C and B, and lo and behold, those are the 2 hepatitis that are transmitted via contaminated blood. So hopefully those 3 memory tricks can help you to clearly remember hepatitis for the rest of your life. All right, so now let's talk about specific ones with relatable routes of transmission in the dental setting. This is being contaminated blood. So Hep B has a 30% risk of transmission after percutaneous injury through the skin. So this could be you poke yourself with a needle or a sharp burr by mistake. And of course, it has to have the infected body fluid on it. So DNA virus, this is caused by a DNA virus, and it specifically has this thing called a Dane particle. So the Dane particle is a spherical particle found in the serum in hepatitis B, and it's the virion of this causative double-stranded DNA. So the vaccine for Hep B is available, and I'll cover this again a little bit later, but the Hep B vaccine must be offered and available to all dental employees. So that's really important because 30% risk is relatively fairly high. So everyone should have a vaccine to be covered. Now, post-exposure prophylaxis, this means a cure after you have said disease, in this case Hep B, includes the vaccine and possibly an immunoglobulin in addition to that. All right, next, Hep C. This is the other one that is caused or transmitted, I should say, via contaminated blood. So this one is a bit lower risk at 1.8%, again, after percutaneous injury, needle stick, etc. This one's caused by an RNA virus instead of a DNA virus. And this one, no vaccine is currently available, although they are working on one. And post-exposure prophylaxis has recently become available, but the course of medications is incredibly expensive. So again, this is fairly recent. When I was studying for the board exam, this was not a thing. Hep C was not curable. Now it is, but it's extremely expensive. So if you have acute hepatitis C, that's most likely going to go away on its own. But chronic hepatitis C that lingers around can cause some serious cirrhosis, which is liver scarring, and these are the cases where medication may be considered. All right, so next we have HIV. So we're no longer talking about the hepatitis family of viruses. Now we're talking about HIV, which is another RNA virus. This one has actually a very low risk of transmission, only 0.3% after percutaneous injury. This one's diagnosed when antibodies to HIV are detected in the blood by this thing called an ELISA test. So that's a nice high-yield thing to remember, HIV and ELISA. No vaccine is available for it, and post-exposure prophylaxis is a lengthy course of antivirals. Again, not cheap. All right, next we have TB or tuberculosis, and this one is really important to know for the dental clinic because a patient or an employee if they've traveled outside the US in certain countries, TB can be transmitted relatively easily if you have someone with an active TB infection. So this one's transmitted via infected droplet nuclei. So this is different from the other ones. Everything else we've talked about in detail has been percutaneous injury with contaminated body fluids. This one is caught via infected air. So TB is diagnosed by, and fortunately there are a lot of different ways we have to diagnose TB. Symptoms include coughing up blood, night sweats, and very high fever, and this is pretty specific for tuberculosis. Now, I actually had a case of necrotizing pneumonia, which is a very rare form of pneumonia, and I had a lot of the same symptoms, coughing up blood, night sweats, and it was not fun, but don't worry, I'm okay, and that was a little while ago. But for any other disease, the symptoms I'm describing are very specific for tuberculosis. Now, you can also diagnose this via a sputum culture. So I had to do this to rule out tuberculosis. And so you cough up into a test tube and they test for the presence or absence of the mycobacterium found in TB. Chest x-ray is another good thing to do. This is, you have some cavity in your lung that's specific for tuberculosis, and you can do a blood test or more commonly a tuberculin skin test. So a patient with active TB should not be seen for elective dental care. Now, if it's an emergency, while in the dental clinic, everyone should be wearing a protective mask, which makes sense because we know it's transferred via droplet nuclei in the air. And so healthcare workers should have this tuberculin skin test at least once per year. This is a high yield fact. I've definitely seen it come up on the board exam. Get it at least once per year. Now, the skin test is the standard method of determining whether a person is infected with Mycobacterium tuberculosis, the infective agent. So they inject a tiny amount of tuberculin purified protein derivative, or PPD, into your forearm, and then they look at your arm in 48 to 72 hours and see if it's indurated, which means it's hard and raised, and or red. All right, so some personal protective equipment, or PPE. I'll go over this relatively quickly. We have, of course, our gloves, latex, which is going out of style because of latex allergy. So there's also nitrile gloves and other forms. So whenever touching something that's contaminated with body fluids, you should be wearing gloves. And you, of course, should be switching out gloves whenever you're switching patients or you're going to wash your hands, or you're touching a new surface that's contaminated by some other source, etc. So you should be changing gloves relatively frequently. Utility gloves are a lot thicker than your normal gloves, and they shouldn't be used during surgical procedures because they instead should be used to wash and rinse dirty instruments prior to sterilization. Masks should be swapped out per patient. Protective glasses, or if you're working as a dentist, you may be using loupes that are also serving the purpose of protecting your eyes. This is protecting from spatter, splash, and projectiles. And a good thing to know for the board exam, the personnel most at risk for eye injury is the dentist. And gowns should be switched out per day, unless you have some gross debris, blood spatter on it, etc. Then they should be swapped out more frequently. All right, the Occupational Safety and Health Administration, or OSHA. You've probably heard of this organization. So this concerns everything inside the office. So they're responsible for determining regulations for everything that goes on inside your dental office. OSHA protects healthcare professionals from occupational hazards, which is in the name of the organization. And as part of OSHA, what I mentioned before, all dental workers must be offered a free hepatitis B vaccine. So that's really important, that should be paid for by the employer, that all dental workers should be getting this vaccine. Any dental worker who experiences a needle stick injury must have an exposure incident report written, and then must be immediately given a paid for, again, by the employer, a confidential medical evaluation and a follow-up. Clothing worn at work, so if you have reusable gowns, they cannot be washed at home, which is an interesting regulation, but it does make sense. Everything should be washed at the office where it's being used. And lastly, the Hazard Communication Standard, or HAZCOM for short. This was created by OSHA to make sure employees know about potentially hazardous materials like amalgam and silver diamine fluoride, for instance. And we'll talk more about safety data sheets in the next video on material and equipment safety. So if OSHA is everything inside the office, the Environmental Protection Agency, or EPA, concerns everything outside the office. So some important things to know for this and their regulations: established maximum exposure levels for mercury vapor are at 0.1 micrograms per kilogram body weight, yada yada. And then it also regulates transportation of dental waste from dental offices. So dental waste out of the office, other potentially hazardous materials into the office, the EPA regulates the transportation of that. All right, now let's talk about some specific methods of sterilization. So sterilization, an incredibly important definition, involves the destruction of all life forms, including bacteria, viruses, and spores. So that's really important that it includes also spores, because other methods that we'll talk about will not take care of these spores. So glutaraldehyde is our first method of sterilization, and this involves making a bath of cold solution used for heat-sensitive items. So this could be like rubber ligature ties and orthodontics, or plastic impression trays, things that can't withstand very high temperatures. But this does require a long time of said instruments sitting in this bath of glutaraldehyde solution. Next, we have pressure sterilization, also known as the autoclave. And so the autoclave involves a very high temperature, 121 degrees Celsius, at 15 psi, pretty decent amount of pressure, for 20 minutes. And this setting is governed by the FDA. So it's a pretty standard 121 at 15 psi for 20 minutes. And it is worth committing to memory for the board exam. I would definitely encourage you to do that, because some of this information can absolutely appear on there. So what the autoclave essentially does, it's using some high temperature, moist heat and also pressure to destroy bacteria by denaturing their proteins. So denaturation of proteins is the primary mechanism that the autoclave is taking care of bacteria. Now, biologic monitors, these are test strips containing spores to test the effectiveness of the autoclave. And this should be done weekly to make sure that your autoclave is functioning properly. So again, you put test strips in, they're color indicated or some other indicator, and they'll have spores on them, and it'll essentially confirm for you that your autoclave is doing its job. There are also process indicators, which are similar. They're test strips that change color if certain physical conditions are reached, specifically the temperature and the pressure. All right, we have two more methods of sterilization. We have dry heat sterilization, which involves heating instruments at 160 degrees Celsius, so even hotter than the autoclave, for 60 minutes, so a bit longer as well. Now, only glass or metal objects can be sterilized with this method due to the incredibly high temperatures. Now, I do like this setting because it's relatively easy to remember, 160 for 60 minutes. Some people will say 160 degrees Celsius for an hour. You can remember that as well. I just like that the 60 and 60 line up with each other. So dry heat destroys bacteria by coagulation of proteins. So where the autoclave destroyed bacteria via denaturation, this one destroys them by coagulation. So for what that's worth, it is a high yield fact for the board exam. This method also, interestingly, has the best preservation of cutting edges. So if you have important instruments, scalers, ligature cutters, whatever you need you want to preserve sharp edges, that's the way to clean them. Lastly, we have ethylene oxide. Ethylene oxide gas uses relatively low temperatures, especially compared to the previous two methods, and can penetrate materials to sterilize pre-packaged items. The best example I could come up with are PSP plates used in x-rays. So PSP plates have these thin, like plastic packages when they're after they're used, and you put them in new packages. And so ETO is the typical go-to sterilization method for those. It does require a lengthy aeration process, though. All right, so that was sterilization. Now we have disinfection, which is another category of cleaning things. These disinfectants are used on inanimate objects only, so we're still talking about instruments, etc. We're not talking about using this on yourself. And here we go, spores are not destroyed in this process. So if sterilization is your top tier cleaning, disinfection is one step down. But the good news with disinfection is Mycobacterium tuberculosis is taken care of. Now that is a very difficult microbe to kill. So your benchmark for proper disinfection is if you can take out that microorganism. Here's another important number to remember when we were talking about times before. Letting disinfectant sit for 10 minutes is ideal, and then wipe afterwards. And lastly, this is our third tier of cleaning, is antisepsis. So antiseptics are used on living tissue to reduce the bacterial load. And these are, of course, not typically as potent as the other two methods. So some examples, we have alcohol, which is the most commonly used antiseptic, and it involves denaturation of proteins, which we saw before as part of the autoclave actually kills bacteria in the same method. Chlorhexidine is another antiseptic used, and this one has substantivity, which means it has a continuous long-lasting effect, so that is a nice antiseptic to use. Detergents help loosen and remove microbes from the surface with rinsing. So detergents, think like when you're cleaning, washing dishes, and you can use detergents to help loosen the grease and other things on your dishes. Similarly, an antiseptic detergent works. And lastly, we have quaternary ammonium compounds, or quats for short. These are probably the most potent on the list. They disrupt cell membranes, and they're lethal to a wide variety of organisms, except, unfortunately, endospores, TB, and non-enveloped viruses. Endospores being taken care of by sterilization, TB taken care of by disinfection. So antisepsis, again, is the low-tier form of cleaning. All right, we're almost done. Disposal of wastes is another important categorized thing to talk about. And we have our sharps, which are needles, scalpel blades, burrs. These should be disposed via a sharps bin, typically a red bucket with a plastic covering that you toss all your sharps into. Infectious waste includes extracted teeth, gauze with blood on it, gloves, gowns with blood or saliva, etc. These should be collected in a separate waste bin, and it should be marked as a biohazard. And lastly, we have non-infectious waste, which includes plastic covers on your operatory chairs and your own chairs, cups, bibs that aren't infected with blood or saliva. They can be disposed of in normal trash. So as a side note, the least chance for needle injury is when you're setting up the operatory, and the most chance to get one is actually when you're cleaning up. So specifically when you're trying to recap the needle of a syringe, and secondarily you're trying to throw or dispose that needle into the sharps bin. All right, and lastly we have the Spaulding classification system. And so this is denoted into three categories: critical, semi-critical, and non-critical. So a critical object or instrument is one that contacts sterile tissue or the vascular system. So this could be like a needle or something that's penetrating the skin and contacting sterile tissue beneath the mucosa or skin layer, and potentially the vascular system of the patient. So these things require sterilization. And we know now that sterilization kills all life forms, even spores. Semi-critical objects or instruments are those that contact mucosa. So you need at least a minimum of high-level disinfection, but sterilization is best if the material is heat stable and can handle that autoclave or dry heat sterilization. Examples of semi-critical instruments that just contact mucosa would be the mouth mirror. Non-critical instruments or objects contact the skin, so these you only need to disinfect. Examples would include blood pressure cuffs, the x-ray apron, things that are just contacting the patient's skin. All right, and that's it for this video. Thank you so much for watching, everyone. If you're interested in supporting my channel, please check out my Patreon page. A huge thank you to Michael Raja, Reb Boyd, Leonilla Bunger, David Jaden, Yanet, Nicole, Isabella Caldis, and all of my patrons for their support. You can unlock extras like access to my video slides to take notes on and practice questions for the board exams. So go check that out. The link is in the description. Thanks again for watching, everyone. I'll see you in the next video.